friends and partners. As usual, I'm here with you today on behalf of the National Health Service of Ukraine team with our traditional weekly briefing on NHSU strategic scope of activities and what's been on our agenda this week. This week, I'd like to focus on the primary health care as well as services we all can receive at the outpatient level. Payment mechanism for primary health care changed 2 years ago. Ukrainians received the opportunity to freely choose their doctors regardless of any formalities. Since July 2018, the main principle of healthcare facilities financing is money follows the patient. As of today, more than 30 million Ukrainians have chosen their doctors. There are over 23,000 PHC professionals registered in the health. 35% of them work in rural areas. More than 1,300 work in private facilities or are self-employed. The number of primary healthcare providers is constantly increasing. This year, it has increased by 144 new providers in the network, including 103 private ones. This fact forces medical facilities to improve the quality of services to involve best doctors. Therefore, the patient has an advantage because he or she has an opportunity to choose the doctor he or she trusts at any contracted by NHSU healthcare facility, and he or she receives the best quality of services. For example, under the reimbursement program, people with cardiovascular disease, type 2 diabetes, bronchial asthma can get the necessary medicines at the pharmacy for free or with small copayment. There are over 2.3 million patients who are active users of the program. 449,000 of them live in rural areas. Patients can also receive specialized healthcare at outpatient level. As of now, the NHS has contracted 1,429 medical facilities, 34 of them are private ones. The NHSU has already paid $2.8 billion for the outpatient services provided within period April-June this year. Thank you for your attention and see you at the next briefing.